Welcome to the MedStory podcast, where physicians learn how to build brands, amplify their voices, and open doors to new opportunities. In today's episode, we're sitting down with Dr. Jocelyn Fitzgerald, surgeon, educator, researcher, and a rising voice in the medical community. Dr. Fitzgerald has mastered the art using social media to advocate for patients, dismantle medical stigma, and really accelerate her career beyond what she ever imagined. We'll talk about how the pandemic changed the way that doctors share their story, how to create meaningful content without risking HIPAA violations, and how storytelling can spark real change for both patients and your career. So if you ever wondered how to start building your presence, or how your lived experience as a doctor can become a powerful platform for impact, then this episode's for you. Let's get into it. So tell me, you are incredibly active on social media. What made you first want to get on?
I guess I always have been a pretty creative thinker, like someone who likes to produce a deliverable, like from a writing perspective, but also I'm a very visual learner. I enjoy just like aesthetic content creation and had a lot of ideas. I remember thinking like a lot of these things I text my friends and family would be good tweets. And so I was encouraged to use social media as an advocacy tool. Got into it probably the most heavily 2019, 2020. I was still a fellow, but it was really encouraged where I trained at Georgetown. I had some great mentors in that regard, attendings of mine who were also very active on social media. And then COVID hit, and it was a perfect time for doctors to really be advocates. A lot of the fears we had of saying or doing the wrong thing no longer really applied because we all felt like we could literally die doing our jobs. So we at least needed to say things before, who knows, it was too late. So that was how I got into that community. And it was a really powerful time to be on Twitter in 2020, 2021. The medical Twitter community was very bonded, and I learned so much from them. And I guess it just got bigger from there. And then I would see things and my brain would start just turning it into a tweet.
That's interesting. So you feel that the pandemic actually empowered or allowed medical providers to feel a little bit more free to share their opinion?
Absolutely. I witnessed it. Like residents, trainees, people who would maybe have been scared to look like they were criticizing their healthcare system or criticizing, I don't know, just like the way that we deliver healthcare suddenly was like, I could die doing this job. So I am going to tell people what's really happening. And yeah, it opened the door also for just a lot of taking the lid off of issues in medicine that people aren't aware of. So I started talking about OB-GYN in that way.
I believe that there's been a big push there, and I have seen so many more medical providers get online. But I will say there definitely is still a big portion of them that are still scared. And so what would you say to those ones that are scared to speak out?
It depends what you're sort of speaking out about. Obviously, you don't want to burn any bridges and you don't want to lose your job. But there's just things related to taking care of humans that are worth talking about. We're going to talk about in the show about incontinence or about the disease process. There's a lot of things that are making it more difficult for us to take care of our patients. And so you just have to think, where is the line between patient advocacy and being able to still function within a system that is far from perfect, but has a lot of still like really good people within it who are doing their best in a system that isn't really as built for doctors as it perhaps once was.
For sure. And if you are like a doctor or a healthcare provider, you are living a lived experience that is a very unique one. And you are seeing a side of life that in reality, majority of people are not seeing. And I find that some are like, I don't know if I should tell that story. But the truth is that we learn through stories and we learn through those experiences.
Yeah.
So if you tell that story and share how you were able to identify what was going on and how you helped them, and then share that, you have potential to help even one person, then sharing the story is definitely worth it.
I agree. I see so many patients who have women, my patients are all female, who have been victims of medical gaslighting. They've been told for years and years. This is a story that I tell a lot, and I try not to use individual patients unless they've given me explicit permission, of course, don't do that. But themes of patients I see over and over again who have been told that their pelvic pain is normal, and or that like their GI issues or their bladder issues are they don't know what's wrong with them, and there's nothing wrong with them. Then it turns out they have endometriosis, and just like nobody had ever suggested that this whole constellation of symptoms they have could be that. And so I feel like I tell that story over and over again, and it's true. And that really, the engagement that I've gotten just from talking about sometimes the rage that I feel seeing a patient who I'm the 10th doctor they've seen, and to me, it's so obvious what is wrong with them. It shouldn't be that confusing. Like, endometriosis enrages me. Like, a woman who is coming back to the ER time and time again for pain between her belly button and her knees has endometriosis till proven otherwise. It's so pathognomonic. It's like you have pain, you keep coming back to the hospital, everyone keeps saying there's nothing wrong with you, they keep putting you through a CT scanner, it's not showing anything. Like, it's endometriosis. Get a grip, everyone. It's like not that hard. That
Man.
makes me so mad. And so when I tell those stories, the number of women who chime in the comments and say, I mean, I'm talking thousands of women have had the
Wow.
same experience, is always just enraging. But then I'm like, okay, so in my comments, I see women realize what's wrong with them in real time, and it's awesome.
And that's the power of story. That's the power
Yeah,
of you sharing the story, and like that lights them up. It gets them fired up, but it also raises awareness.
it does.
How do you manage? Because a lot of providers are scared because of HIPAA and they don't want to break HIPAA laws. How do you manage sharing those stories, but doing it in a legal way?
Yeah, you obviously should never give patient identifying details of any kind. And the biggest mistake I see people making with that regard is posting about things that are like date of service experiences. If you see a patient that day in the office and there's something very specific about them, unless you asked them, I have done that before, asked patients like very specifically, you should not be posting about that because if it's public, they can identify themselves or like their family member can identify them. So if you haven't gotten explicit written permission and there's any detail in that story that makes that patient unique or identifiable, you should absolutely not post it. If it is something more general, it's, oh, yet again, I saw another patient today who has painful periods, bladder pain, GI symptoms, and like painful intercourse. That's a generic story. I hear that story over and over again. You wouldn't be able to identify which patient that was from me posting it. So I'd say always err on the side of being more conservative because you never ever want to be accused of violating HIPAA. Obviously, like you can lose your license. Like nothing is worth that. Or if you think it's something the patient might be interested in sharing, ask them. And then you can document it in their chart. Some hospitals have release forms even that they can sign. I've done both of those things, and patients usually are very happy to help.
Yeah, because they want other people to learn from the situation
For
too.
sure.
And I think when you're telling those stories, even if you keep it general, it's those general things that most people can associate with.
For sure.
And that's called, when you're telling a story like that and someone says they put themselves in those shoes, it's called narrative transportation.
Oh,
And basically what's happening is that they're being like, oh, wow, I can see myself in this story. And then they're in it and they want
yeah.
to listen.
Huh.
And so it's okay to share things like that. I think
Yeah.
it's really cool.
I did not know that phrase. That's awesome.
So you are advocating. Have you seen that you doing this, has it opened any doors for you or created any opportunities?
Oof. Yes. More than I like ever would have imagined. In some circumstances, too many. I don't have enough time in the day, but it has accelerated the work that I've set out to do more than and I remember being a resident, be like, if I ever really want to make change, I need to just put my head down and slug it through. And someday when I'm 50, 60 years old, I'll be the president of a major organization and I can say what I really feel or make these changes. And that is proven not to be the case. Like, she who travels alone sometimes travels fast. And I'm not traveling alone by any means, but you pick up people who have the ability and resources to help you. They email me, they DM me. I'm asked to be on things like this podcast, but even beyond just a verbal platform, I have made connections with people who have real influence. They're not just like out on the street, like waving a sign in protest, which of course we love peaceful protests. They have contacts of people who work in policy, who have capital and can really move the needle on some things. So yeah, it's been amazing. It's been helpful inside of academia. It's gotten me in front of some really important people. I'm very grateful.
That's amazing.
It is.
What would you say? Do you have any advice for someone who maybe is a doctor and like they're saying, I want to start doing that. I want to start creating content, sharing my experiences. Like where could they start?
Yeah, I give actually a lecture. I give a grand rounds on this and I lecture about this all the time because people have that exact question. I would say you really should start small. I tell all the trainees, medical students, residents, fellows, there should never be a research paper that you publish that doesn't turn into some sort of post. Even if it's a static post, we've discussed like struggle sometimes to make videos where I'm discussing my research because video does take time. You have to do edits. And I think we're all very perfectionistic, which is something I work on getting over. But there's no reason you shouldn't post it on LinkedIn at the minimum, on Blue Sky or Twitter if you still use X or Twitter, on Instagram. It doesn't take a lot to have a free Canva account and to take a screenshot and post your article. And it's been shown in study after study that if you do that, it increases your citations by double, if not triple. So you don't want your research to die alone with you and just a few people in the field read it. So I would say share that. If you feel like there are opinions that you're not sure how to express, if you can find that opinion expressed by someone else in some reputable or evidence-based way, then repost what they say. Like just start by sharing things of people you admire. So much of what I share comes from others. And then yeah, just start small. You don't have to be like a TikToker on day one or ever.
Absolutely. Take the path of least resistance. Whatever feels easiest to you, whatever you enjoy the most, just start with something because it is a muscle. It's a muscle to kind of learn to do it consistently like that.
For sure.
But have you found that it's gotten easier over time?
It has. And I have had to like push myself a little bit a few times. I continue to do that. I really am going to commit to making a few more videos on my own. But I have a sister who she's a business owner and a content creator. And she always says the best social media is the one you're going to make. It doesn't really matter what it is as long as you're going to do it. So if it's not a video, if it's static, if you're going to do that consistently because it doesn't intimidate you, then that's what you should do.
I love it. Awesome. So my takeaways from this one is that start simple with the least resistance. Also understand that with consistency and finding the right people, that it can actually end up opening doors for you greater than you've ever believed.
It is. It's so true. It shaped like I've been an attending for 5 years now, almost 5 years. It has accelerated my career in ways I could not have imagined.
Thanks so much for listening to the MedStory podcast. If you are a physician who has found ways to create opportunities for yourself outside of medicine and are really trying to build something greater than just your clinical job, go to medstorymedia.com and apply to be a guest on the podcast. We'd love to hear from you.